like to have a multifocal ablation. So please tell us your story.
Yeah, so good morning everybody. So my story today is about how I transformed from a skeptic of presbyond to a 100% believer of this procedure. So I think all of us have this mental block. We have heard about presbyopic laser vision correction. We might have heard about it in passing. But the unfortunate part about presbyond is it's usually clumped together with all the other presbyopic laser vision solutions that don't really produce the best results. So there's a lack of general awareness about the procedure, and in turn, most refractive surgeons don't do it, and we don't really understand it thoroughly. So you would have already heard about what Tim just told you now, about how presbyond is not just monovision. When we look at this image here, and we see the dominant eye is targeted for plano and the non-dominant eye is targeted for -1.5. The first thing that strikes us is that, okay, this is basically monovision, but it's not. So what happens with presbyond is, because there is a controlled amount of spherical aberration, the distance eye, which is supposed to see well for distance, also gets a reasonable amount of intermediate to near vision, and whereas the non-dominant eye, which is supposed to see well only for near, also gets a reasonable amount of intermediate to distance vision. So that is why we see the blend in presbyond, and that's why patients are very satisfied and are able to fuse well, and they have a continuous range of vision from distance to intermediate right up to near. So I first heard about presbyond in the ZEISS user meeting in Singapore in 23. So I was listening to a talk by Professor Dan, and he was sharing the results of presbyond. So my first thought was, okay, if the results are so great, why is not this procedure more widely adopted, and why are we still doing lens exchange as a primary measure for treating presbyopia? So that's when I went to the forefront refractive surgery course the same year. So I went to the course and I was convinced about this procedure, and we made the decision to get the MEL 90 machine somewhere around the late 23, around October to November. And keep in mind that I bought the MEL 90 for the sole purpose of performing presbyond, because our practice was already about 90% smile. The hyperopic cases that we have in India is very less. So we used to do a very scattered amount of hyperopic LASIK. But the MEL 90 was purchased for the express purpose of doing this procedure. So yes, I did believe in this procedure, but I didn't 100% believe in it until I did my first patient. So my first presbyond patient happened to be an ophthalmologist. It just happened to be that way. So this was a lady who had come in from UK, and she wanted her daughter to undergo SMILE with us. So once the SMILE was done, they were super happy with the results. And she said, can you do something for me? And that's the exact time when I got the MEL 90 and I offered her presbyond. So I did this patient, and once I present the results to you, you might understand why presbyond is a little different. So this is the pre-op refraction. So this is the right eye. It's got a -5.5 correcting to 6.5 for distance. Left eye has got a -7.25 correcting to 6.5 for near. The near vision ad is about N18. She needs a +2.25 to see for N6 or J2. And the simulation testing, we saw that she was right eye dominant with the -5.565. But the uncorrected near in the dominant right eye was only N18. And the non-dominant left eye, she needs the +150 lens to see N5 for near. And the distance vision in the non-dominant eye is only about 618 or so. But post-op, after doing the presbyond, you can see the results. The uncorrected distance is 6.5, intermediate is N5, near is N5. The right eye, which is plano, the dominant eye, has improved near vision from N18 to N10. Similarly, the left eye with a -1.5, she's able to read up to 6.9 in the distance, whereas she was only able to read 6.18 when we simulated this. So this is where presbyond differs. The dominant eye gets pretty good reading vision, and the non-dominant eye gets pretty good distance vision. So this is where the blend occurs, and there's no cross blur, no anisometropia, and no ill effects of having a little bit of different power in both eyes. So we did run into some challenges. It was not all smooth. The first 6 months we saw our results were mostly good, but sometimes there were some challenges. Some patients were off target, and some patients did complain of cross blur. Particularly, my most challenging cases were the low myo and the emetro, where these patients were mostly off target and they were not too happy with the results. So that's when ZEISS helped us with the onboarding program. So Mr. Sandeep just gave you a fantastic talk on how to standardize your results with presbyond. So he came to us and he spent 2 days with us, and it was an intensive course where he reviewed every single patient that we had done till date. And he told us the mistakes we were making, and what we learned from the whole experience was that we had to standardize the refraction, we had to measure the functional age, and also enter the pre-op spherical aberration that the patient had before the procedure. So in presbyond, the refraction has to be very meticulous and very precise. If you're doing a routine LASIK or SMILE, if you're half a diopter off target, you're mostly going to be okay. But in presbyond, what happens is, because one eye has to do most of the work for distance and the other eye has to do most of the work for near, if you're off target by more than half a diopter, the blend usually does not occur. You can only afford to be off target by about quarter of a diopter. And also presbyond works best when you can measure the pre-op corneal spherical aberration, and you have to enter this into the treatment planning. So the algorithm will correctly get the spherical aberration into the target zone, so the blend will occur very well. Results wise, our results now are pretty good. We've done over 100 patients. So in this 86 patients with about 3 months follow-up, 100% of patients achieved 20/20 for distance and J2 for near and intermediate. 81 patients, that is 78%, achieved 20/16 for distance and J1 for near. 5 patients, which is 9%, achieved 20/20 for distance and J1 for near. So this is another measure of how we can show you that presbyond is different from monovision. These are the depth of focus charts that you can simulate on the eye trace, which tells you the depth of field that the patient will have. So this is an example of a patient pre-op presbyond. He's got about 2.2 diopters of depth of focus binocularly. But after doing presbyond, this gap widens. So as you can see, from 2 diopters, it goes up to 4 diopters. So this is a study I'm currently working on, where I'm looking at all of our patients and seeing what the exact increase in the depth of field is, pre and post presbyond. So I faced a unique challenge when I came into practice. So I practiced with my father, who was a very senior ophthalmologist. So he was also a skeptic. So when I came back from the course, we bought the MEN 90. And in October 23, I told him, let's stop doing lens exchange with multifocal IOLs, as he was a big fan of it and has been doing it for years. He said, I'm not going to stop doing clear lens exchange with multifocal IOLs. You find your patients for presbyond, and I'll keep doing this procedure. So this is going to be a challenge for me, because we would be fighting for the same patient cohort, and I would not get that many patients for presbyond. So that was the challenge I had. But after about a couple of months, in Jan 24, after looking at the results of presbyond, he says, straight off the bat, all the complaints that my lens exchange patients have is not there with presbyond. I will prefer presbyond as a first option for the correction of presbyopia in patients who do not have cataract. So we stopped doing clear lens exchange because the number of complaints that the clear lens exchange patients have was not there with presbyond. These patients can read well at night time, they can read well at low lighting, they have the great distance vision, there's no ghosting, they don't have the doubling effect that your patients with multifocal IOLs might complain of. In October 24, he says, presbyond is the most gratifying procedure to perform in my last 40 years of practice. And finally, in Feb 25, he got presbyond done himself. So my dad's case, he's a 67-year-old. We did the examinations. He had no nuclear sclerosis. His dysfunctional lens index was about 8 to 9. He always had about -2 against the rule astigmatism. Did the procedure. Now post-op after 3 months, he's 6'5" and he's able to read N5. He's very happy. No issues whatsoever. The fun fact was, he got presbyond done on a Monday evening at 5 p.m. Next day morning, on a Tuesday, he had 7 cataract procedures in his list, and he had to operate the very next day. So I was not very nervous while doing the surgery for Dad. I was nervous whether he was going to be able to operate the next day after doing presbyond. And I was in the theater with him, thinking that he might not be able to operate and I might have to take over the cases, but that was not the case whatsoever. So less than 24 hours after getting his presbyond, he was able to operate 7 cataracts the very next day in one morning, back to back, no issues whatsoever. And this is a small testimony that I prepared after Dad's procedure.
You chose to delay your laser eye surgery and get it done at the age of 67. No, I said I've been wearing glasses from the class 7.
My distant vision correction was very tiny, so I needed to wear it just to see a little more clearly. But the need for glasses became permanent only after the mid-40s when reading became impossible without glasses. So yes, at 45 when I started wearing glasses, there was no option. And I have seen the results of our patients, over 100 of them, which are brilliant. Actually, I am a fairly sensitive person as far as the eye goes. Surprisingly, I didn't feel any difficulty at all. Absolutely, I was fine. The procedure is absolutely painless. It just takes about totally 10 minutes. Post that, yes, 6 hours of irritation monitoring in the eye is there. And I got it done on a Monday evening at 5:30. And next morning at 9 o'clock, Tuesday morning, I was into the theatre doing microsurgery.
So now we're totally functional, able to drive at night, we're able to watch TV, read a book at near, we are able to have good intermediate vision at the range of your computer. Do you ever miss your glasses?
Absolutely not. Even though I had clear vision with my glasses, I would get migraine quite frequently when I start working, reading for some time. That having gone away, it's like a switch gone off, my migraine disappeared overnight. Particularly the greys and blacks are very crisp. That's important because for any image to be seen clearly, it's the blacks and the shadows that give you the depth. Suddenly I find that I have even normal vision, driving, everything. There seems to be far better depth than I ever had in my life.
So that was the testimony. And this is something that's very important. This is the difference in the rates of presbyopic patients that we're able to treat in the clinic once we started to offer presbyond as a solution as opposed to offering clear lens exchange. So patients do accept a procedure which is a laser vision correction to correct their presbyopia as opposed to getting an intraocular lens exchange done because they don't want an invasive procedure that is probably not reversible. So the numbers of presbyond in comparison to lens exchange that we're doing are about 3 to 4 times more. So we're able to treat a much larger cohort of presbyopic patients in practice. So to conclude, presbyond is an excellent solution for the correction of presbyopia in the absence of cataract. It works well for emmetropes, myopes and hyperopes, but it does require a very intricate understanding on how the procedure works. I would highly recommend before you start presbyond that you must attend the London Vision Clinic course on how to perform this procedure correctly. And once you do that, ZEISS also offers you the onboarding service to come and help you out and work with you in your clinic in person and help you refine your results with presbyond so you get really good results. So the most important thing is it gives you a unique advantage over your competitors as most of your competitors will not be offering a laser vision correction. Most of them will be giving clear lens exchange. So when you do offer presbyond, you do set yourself apart. So thank you for your attention.